Having a vaginal delivery for multiples is not always the first thought for expectant moms, but it can have its advantages. If you do decide you would prefer a vaginal delivery for your twins, how can you prepare for it? And how is it different from a singleton delivery? I'm Dr. Tevi Tith of the San Diego Perinatal Center, here to discuss how you can prepare for a vaginal birth for your twins. This is Twin Talks.
The ultrasound shows your babies to be healthy.
What? Did you say babies? You're huge. Are you having twins?
Are they natural?
Which one do you like better?
Twins, huh? My neighbor's cousin's brother's uncle's a twin.
So can they read each other's minds?
How do you tell them apart? Twins? You got a 2 for 1.
Do twins run in your family?
Double trouble. You're not having any more, are you?
At least you're not Octomom.
If you're pregnant with twins or you're an experienced twin parent, odds are you've heard it all before. Now it's time to hear from the experts. This is Twin Talks, Parenting Times 2. Well, welcome to Twin Talks, broadcasting from the Birth Education Center of San Diego. Twin Talks is your weekly online, on-the-go support group for expecting and new parents of twins. I'm your host, Christine Stewart Fitzgerald. Have you heard about the Twin Talks Club? Our members get bonus content after each new show, plus special giveaways and discounts. Subscribe to our monthly Twin Talks newsletter and learn about the latest episodes available. And another way for you to stay connected is by downloading our free Twin Talks app, and it's available for most smartphones. Well, before we get started, let's introduce our panelists and everyone who's here in the studio. And I'll introduce myself. I'm Christine Stewart Fitzgerald, and I've got almost 5-year-old identical girls, and they're headed off to kindergarten soon. So I'm excited. And then I do have a 20-month-old singleton who is now officially weaned and on her own. So I'm very happy.
Oh my goodness! Yay!
Yay! So let's go around and let's see. Sunny, can you tell us about you?
Absolutely. Okay. Hey, everyone. I'm Sunny. I'm the owner of New Mommy Media, which produces Twin Talks, Parent Savers, Preggy Pals, and the Boob Group. And I am a twin mommy as well. I actually have 4 children, though. My oldest is 4, and that's a boy. And my middle guy is 2. And then I have identical twin girls who are now 7.5 months. I think. Yeah.
Time flies.
Full house.
I'm Shelly. I'm a high school history teacher, and I'm also the producer here at Twin Talks. I have 2 children, identical twin boys who are going to be 2 next month. And I'm currently pregnant with my 3rd, just 1 this time, though. We're expecting a girl. So I wanted to give you guys a little heads up about our virtual panelist program. If you're not able to join us here in the studio, you can follow along at home. You can follow us on Facebook or Twitter with Twin Talks. Or you can use the hashtag TwinTalksVP to be a panelist from the comfort of your own home.
All right. And today we have a question from Annie in Newport, Rhode Island. She's asking about solid food. She says, my 8-month-old fraternal boys, they seem to be doing fairly well in trying new foods. I give them a lot of mushed up vegetables and mix in some fruit. But lately I've noticed that one of my boys seems to be much pickier than the other and refuses the food I'm offering. So how do I handle this? Do I need to prepare different food for each of them?
Hey, Annie, this is Natalie Diaz, author of What to Do When You're Having Two and founder of Twiniversity.com and Multiplicity Magazine. Just so you know, you are not alone on your frustrations with solid feeding your twins. It's very common that one twin will have a preference of the foods that they like, while the other one I always call the other one Frank the Tank. I don't know if I'm the only one who saw the movie Old School, but that's what I think of. There's always going to be, usually, I shouldn't say always, there's usually one child who's the better eater. So how do we overcome this? Do you need to have 2 separate meals? It depends. If one kid is totally going on strike and wants to eat nothing but sweet potatoes and they're really just giving you a lot of problems, you may have to, but I'm going to tell you, old school mom style, even now to this day, my 9-year-olds know that we have a rule in our house that this house isn't a diner. You eat what's on the table, and that's that. Not saying you should apply this rule for your 8-month-old, but I am saying that you got to figure out a way that they're going to eat what they have. So I wish that I knew specifically what foods they were eating. Do they not want to eat meat? Do they not want to eat veg? Do they not want to eat fruit? If it's a problem that they want to stay with the sweet, just gradually mix in some vegetables and go, 90% fruit, 10% vegetable. And the next day go 20% vegetable. Did I say that right? Well, you know what I mean. Just gradually increase the amount of vegetables that are in the fruit until you're getting a nice 50-50. If that doesn't seem to be working and you do feel comfortable with having 2 separate bowls for your 20s, then of course go ahead and do that. feeding kids and parenting twins, it's not a one-size-fits-all. You have to do whatever you feel is best for your twins. If you think that it's an issue with texture, let's say they don't want to eat chunky or something, you may want to speak to your pediatrician about it. You should always speak to your pediatrician if you really have a concern. But as far as having the picky eater, you could just have a picky eater. Not every twin will just eat whatever put in front of them. So try tomorrow. Start a little bit, do a lot of fruit, a little veg. Try to change that. Try to give them what they want, alternating with something that they don't want. So let's say you blended up some chicken soup, and then they love having mashed pears. Give them 1 spoon of the chicken soup, 1 spoon of the mashed pears. You could even keep it in separate bowls. Try that, see how it goes, and there's actually a ton of resources on twinversity.com in regards to feeding your multiple. So you may want to check that out. There's a lot more specific, questions and answers up there. But I'm sure if you get back to the New Mommy Media team with a follow-up, I'd be more than happy to help whenever you need me. Have a good day, take a deep breath, and try not to get frustrated. If you get frustrated, the babies will sense that, and they're going to shut down, and they're going to shut their little mouths. So take a deep breath, put on some great music, and just make eating time fun time. Good luck. I hope today everybody eats everything that's in that dish. Bye-bye.
Today's topic is preparing for a vaginal birth, and today we're talking with Dr. Tevi Tith, who's here to help us understand what an expectant twin mom needs to know to plan for a vaginal delivery of her baby. So thanks for joining us.
Thanks for having me.
Yeah, so I know you see a lot of twin moms in your practice, and if she decides, hey, I really would like to try for a vaginal birth, what makes her a good candidate to try for that?
There are definitely several things that make her an excellent candidate. The first thing we always have to consider is her safety, as well as the safety of the babies. So like I tell all my moms, baby A always determines which way the party goes. So first and foremost is baby A is head down. The second thing is really to figure out what kind of twins they are. So if they don't share a sac, that's also the best kind of twins to have vaginally. We ideally would like for the twins to be at least 3+ pounds each. So 1,500 grams is usually our cutoff for having twins vaginally. We don't want for there to be a discrepancy in the size of the twins. So hopefully they're about the same size. Anything over 15 to 20% makes it a little bit more unsafe, particularly if baby B is the bigger one. And then finally, if they've had a vaginal birth before, that's just a bonus, but it's not necessary. So those are the most important things in determining having whether or not it's safe to have a vaginal delivery for twins.
And it sounds like this is mostly factors about the babies themselves, and then for the mom on the maternal health side of it, are there anything that relates to either her health? Like if let's say if she's overweight, or does that make a difference?
So we use the same criteria for even a singleton mom. So if she's had a prior vaginal delivery, if it's in a horizontal direction, she could potentially be a candidate for a trial of labor for twins. I've done that before. If she's had a C-section in a different direction, then she may not be. So it's the same criteria that you would use for singletons. If she has certain cardiac or pulmonary problems, then she may not be a candidate just for her own health. So we would again use just similar criteria that we would use for twins.
What about those common complications, I guess, like we have preeclampsia or gestational diabetes, the things that are more common with twins? How do those affect her likelihood of being able to deliver vaginally?
Again, generally, our success rate is usually the same for both, for gestational diabetes or for somebody who has preeclampsia. But for somebody who has preeclampsia, for instance, you have to make sure that the safety of the mom is ensured. And with preeclampsia, the cure for preeclampsia is delivery. So if you don't think you can expedite a delivery of twin pregnancies in in a quick fashion, then you may have to do. She would really be a candidate for a C-section instead. So.
And then, I mean, is there, anything that a mom can do during her pregnancy if she says, okay, I'd really like to have, a vaginal delivery? Is there anything that she can prepare for on, I don't know, health-wise for herself?
So, just like with a singleton pregnancy, we want to encourage mom to increase her caloric intake. So what's recommended for singletons is above baseline, about 300 calories a day. For twins, it's probably more along the lines of 300 to 500 extra calories a day. And again, that's not empty calories. You have to be healthy.
I know. Look, I remember eating lots of protein.
Yes, exactly. And then just educating and counseling patients extensively about nutrition, keeping stress levels low.
So there are some positive things that we can do if we said, hey, we'd really like to have that. That's great. Now, just in making that decision, I mean, let's say a mom has really said, well, I'd like to have a vaginal delivery, but I'm not sure. What are some of the pros and cons of each delivery type?
Well, looking at it from a maternal aspect first, definitely the pros of having or the advantages of having a vaginal delivery include shorter hospital stays, typically fewer problems with anesthesia, so fewer anesthetic complications. Usually it's less of a blood loss if everything goes very well. There are some studies that have looked at breastfeeding initiation rates being higher after a vaginal delivery, but when you look at it downstream 3 months, 12 months down the line, there isn't really a difference between C-section and vaginal, but initiation rates appear to be a little bit higher.
And that means that's basically starting breastfeeding immediately after birth.
Exactly.
Okay.
Exactly.
Okay. Yeah. So that so the moms who have the twins vaginally might have a better success rate of getting the baby starting to breastfeed, and I think that's probably one of the most critical time periods within breastfeeding.
The immediate postpartum bonding experience. So from some of the disadvantages, obviously, there's always a small risk of conversion to a C-section for patients who start vaginally or who have a planned vaginal delivery first, and then it ends up getting converted to a C-section usually for fetal indications.
And when they are converted, I have also heard of in some cases where a woman is able to deliver one vaginally, and then for some reason the second one is in a position or something happens where the second one needs to be delivered surgically. How often does that happen?
About 4% of the time, give or take.
Okay.
There was a really large study that was recently published in the New England Journal of Medicine, and this study took over 10 years and many, many countries to participate in. But I'm glad the study was done because it has provided so much good, useful information for us. And it looked at the safety of vaginal twin deliveries versus planned C-sections, and it showed that vaginal deliveries were just as safe as C-sections.
Oh no, and that's good to know. So that's something that's pretty rare, and I think for a woman kind of
considering your options,
like, well, that's probably not a big likelihood that would happen.
No, it's just something that you would want to remind mom that could possibly happen.
Is there anything that would make it more likely that you could be aware of that would make it more likely that you would have to deliver one each way?
Yeah, interestingly, the in terms of having to convert sort of midway through the delivery, the one thing that sort of increases that likelihood is waiting too much or waiting for too long to deliver the second twin. So there are definitely studies that have shown that if you actually after the delivery of the first twin, immediately go and try to deliver the second twin, your success rates are much higher. And whether that's vaginal or whether that's Vertex or doing like a breech extraction, it's actually much more successful if you immediately try to go and deliver the second one.
And would that size discrepancy you talked about, would that increase the likelihood?
Hopefully you would know that ahead of time, with ultrasound at least within the week of delivery, so that you could try to prepare yourself for that. But definitely if twin B is significantly bigger than twin A, then that is definitely a possibility.
Mm-hmm. And when you talk about having them delivered within a time frame, is there a certain time frame? I mean, we've heard of deliveries being within 10 minutes, 45 minutes.
It's funny. Generally, we say we'd like to deliver the second twin within an hour. Mm-hmm. Some other authorities may say within half an hour, but I've done this before, and I like to have them delivered hopefully within 10 minutes of each other.
Wow.
But it's not always possible. It's definitely not always possible, and I've definitely sat there for an hour waiting for the second twin, especially if the second twin is vertex and the cervix hasn't closed. Then I'm happy to give it time and to wait for the second one.
Mm-hmm. So, it sounds like there are just a lot of variables in the timing and, the mom's health. And
yes,
I can say in having done a VBAC myself, it's a lot of work pushing a baby.
That's why they call it labor.
Well, and then what kind of support could you recommend? So we all know with twins, they have their own plan. So even the best laid plans for vaginal delivery don't always go well. But is there anything that has been proven to improve chances? Is there more support person or other things that she could do?
I think that definitely having a really good support person is really important in the delivery process. One of the bigger differences in terms of delivering vaginally for twins is also the fact that when we push, we usually will push in the operating room instead of the labor room. And usually when you're in the labor room with a singleton, you can have a lot of family around. When you're pushing in the OR, you can really have one other family member around, and it's partly because the ORs are a lot smaller. And if we have to quickly convert to a C-section, for instance, then you would want to just have to usher one person out instead of a whole family member, or instead of a whole family. So that is definitely one big difference, but that support person is very key, is very integral, but also having the provider explain everything that's going on and who everybody is really important too, and what processes are taking place. So for instance, after the delivery of the first one, we'll usually do an ultrasound, we'll do an exam, and we'll tell mom what we're seeing, and if we need her to push or to bear down or something, then she could be an active part of the whole process.
Mm-hmm. And so some hospitals will let twin moms deliver in a regular labor and delivery room. So that would be, I guess, something to look at when you're choosing your hospital if you wanted to have a support person like a doula or something like that.
It sounds like it depends on a medical provider. So within your practice, that's probably a standard procedure. And then some hospitals might have different policies in place. You have to ask around.
Yeah.
Right. Yeah.
I have a question when it comes to the space that's available to do that. So if you are laboring in a OR room, so I've had 2 cesareans and 1 vaginal birth. My twins were cesarean, so this doesn't quite apply to me. But the question would be, I know how valuable that OR space is, and you can be in labor. With my first, I was in labor, which ended up being a vaginal delivery for 14 hours. Nothing crazy. Yeah. So is it fair? So how does that work? At what point will they take them in there?
Yeah, it's not. Yeah. It's definitely not for the whole labor process at all. No. It's actually just at the very end when
once they reach 10 or something.
And even past 10, once they're starting to push. Once they start to push, then we'll usually bring them to the OR.
Okay,
but definitely not during the whole labor process, because that can take a while.
So somebody who wanted to have a doula or another support person there, they'd still be able to have that through the process.
Yeah, no, exactly. What I'm really referring to is really just that last part, kind of the last hurrah, before, the marathon before the pushing.
Right.
Mm-hmm.
Right.
And earlier you talked about the position of the babies as being one factor of the success of having a vaginal delivery. And I know I see questions all the time from moms who say, well, I'm 36 weeks and I've got baby A's head down and baby B is breech or transverse, and when are they going to flip? And how important is that factor? And then once they do get to labor, if that second baby is not head down, what can be done as far as moving the baby around?
For having a twin vaginal delivery, the real important part is really just having twin A down. Because in the end, even if they're both head down, after delivery of twin A, baby B can flip.
So baby B could be head down,
yep.
And then, baby A is born, and it's like baby B's like, hey, I've got lots of space.
Yeah.
Let's do some flips, little gymnastics. I'm having fun. Hey, I got the place to myself.
Yeah, exactly. I've definitely seen that happen. I've definitely seen twin B who was breached the entire time suddenly flipped to vertex. So what's most important is really the position of twin A.
Mm-hmm. And if baby B does flip, then, what type of procedures can be done?
There are definitely a couple of different options. Typically, if baby B has flipped and is now breached, you can actually go in to do or is either breech or is transverse. You can actually go in to do what we call an internal podalic version, and it just means that you go in and you grab one or both feet and you bring it down to the cervix, or you bring it out of the vaginal canal and deliver baby B breech.
Okay. Now, when you say when you're grabbing onto the feet, are we talking about a footling breech delivery, or you're just kind of?
It is essentially a footling breech. Well, it's essentially a breech delivery.
Okay.
You grab one foot, the other foot will follow, and you will deliver the baby backwards or feet first, which they used to do all the time, actually, a long time ago, even for singleton deliveries. But presumably, if baby A has passed through the vaginal canal, then they've made space and room. They've paved the way for baby B, and you should be able to deliver baby B.
Wow.
Yeah.
That sounds like that's kind of an art form too. I know in medicine you've got sort of the science, but then looking at a situation, you figure, well,
yes,
different opportunities.
You definitely have to have a provider who's very comfortable with those types of manipulations, intrapartum. You also, we are blessed in that we also have the technology to see all of this through ultrasound as well. So I will usually use ultrasound. A lot of providers will use ultrasound to help diagnose what position the babies are in, and then to follow and to use their hands to flip the baby.
And I think the woman would want to have a discussion about, sort of here's some different scenarios, and what are my options, and find out about the provider and their philosophy as well during the prenatal checks.
Absolutely. So anybody who in our practice is diagnosed with twins and is a candidate for having a vaginal delivery, we always have that discussion of mode of delivery. What are we planning on doing when she goes into labor, or around the time of her due date. So really we have to truly counsel the patient, and we can't really make a definitive plan until a little bit later when we know where the babies are going to settle.
Well, talking about sort of the delivery, and actually kind of taking a step back, when moms are, just arriving, getting at the hospital from the kind of the point of active labor, how do you approach the delivery process? From a monitoring standpoint, frequency of cervical checks. How much different is it to, give birth to twins as opposed to a singleton? What would the moms expect, especially those who maybe they've already had a singleton birth?
So if they come in labor, that's usually a good sign, and it increases their chance of success. But for the most part, they would come into triage. They would be evaluated for labor. If they're diagnosed with active labor, then they're usually admitted to labor and delivery. We will monitor the twins closely. So the real big difference is monitoring. You've got two of them in there, so a lot of times because of their movement, the monitors just have to be adjusted more frequently. The frequency of the cervical checks aren't any different. You still try to follow the same labor curve until the babies deliver.
It's pretty much the same, but
yes.
But you got a little bit more equipment going on here.
Yes, exactly.
And when it comes to pain management, are there any differences in terms of the pain management and getting epidurals or any types of other drugs? Should moms be concerned in any way of what they're using for pain management?
No. So the pain management is usually managed about the same way. We do recommend for moms to get epidurals where we're planning to have a vaginal delivery of twins. A large part of this is really for the delivery part, or in the event that we would have to do something very rapidly. So something like an internal pedalic version, for instance, is not the most comfortable thing to have to go through. So we would recommend for moms to be comfortable just in case it's something we have to do very quickly. Either that or, again, in cases where in rare instances where we would have to convert to a C-section rapidly, you would want to have moms at least have their epidural, their anesthesia available already.
And I think included with that, so when you talk about having an epidural, I mean, I've heard of different types. I've heard of a walking epidural as well. Is that an option?
It is probably options at different. It's probably an option at different hospitals. So I think that's probably a discussion that you'd want to have with the anesthesiologist to see what level they could have the block at, and what options would be available.
Twins have to have external fetal monitoring. Is that all? Because I know I started with an induction, and I know that when you're induced with Pitocin, you have to have both monitors. So is that all twin deliveries? Pretty much, is that standard? They have to have external fetal monitoring?
They should. Again, one of the main risks that we worry about with the twins is actually a risk of what we call an abruption, where the placenta separates prematurely after delivery of the first one. And so a lot of times after you deliver the first one, there's a rapid decompression of the uterus, and that can potentially cause some separation of the placenta and the uterus, which you don't want to have, especially if baby B is not ready to deliver yet. So usually we do recommend having monitoring during the delivery.
How common is internal fetal monitoring? So my boys' heartbeats were identical, so it was really hard, and they were in the same position, very close to each other, so it was really hard for them to ensure two heartbeats on the monitor. So I actually had one on an internal and one on an external. Is that common, or is that unusual?
You definitely can have that, especially with if you are dilated enough and baby A is well applied to the cervix or engaged in the pelvis, you can definitely monitor baby A internally and then baby B externally. That's definitely possible.
Is it common, or is it kind of not?
I think the practice is variable with different practitioners. We generally try not to put too many instruments into the vagina because of potentially an increased risk of infection. If it's necessary, then we will typically do that. So I'd say it's provider dependent.
Well, when we come back, we're going to talk about what you can expect in the labor and delivery or the OR room, who's there, who's helping you out, and what happens. All right. Well, welcome back. Today we're talking with Dr. Tevi Tith, and who's helping us understand the vaginal delivery process and who are those medical providers and all the people wearing white coats that are in the room. we know for the moms who are doing C-sections in the OR, and there's going to be this whole surgical team. But what about when doing a vaginal birth? And we know that there can often be a lot of people on the support team. Who is that, and what do they do?
Well, I think the most important support team that you have will be your family or whoever you bring to the labor room with you. They provide support and comfort and encouragement throughout the whole labor process. Another really very integral part of the team is your labor and delivery nurse, and she's really with you the entire time that you're laboring. She'll explain everything that is going on, what medications you have, or what medications you need. She'll give you options in terms of pain medications, and then obviously your doctor, who is also there to support you and to help provide a safe delivery. And then the anesthesiologist is important as well, and hopefully you'll be able to meet them before you before you have an epidural or whatever anesthesia you end up deciding to go with. And then after the delivery, before the delivery, while you're pushing, there's usually a larger birthday party that comes to the delivery room. A large part of who comes is dependent on the gestational age of the babies at delivery. So if we anticipate that the babies are less than 36 weeks and potentially at risk for respiratory problems, we will usually have the ALS team there, which is Advanced Life Support Team, and that usually consists of a nurse and a respiratory technician. And if there's two babies, you have to multiply everything by 2.
Oh, yes.
So there's usually a lot of people who are there, and then there's usually ancillary staff that help to circulate or to just help out the team with whatever they need.
So for moms, if you've got a big crowd of people there, what do you tell them? Just dim the lights as much as you can, close your eyes.
Yeah, we actually do. When we have patients pushing, we will often have the lights dimmed, just so that we can really focus on the baby and the mom. Most of the time, I do warn moms and dads ahead of time that there will be a lot of people coming in right at the end. Their role is to make sure that the baby transitions safely after the delivery, and to make sure that the babies are stable.
Mm-hmm. And before they actually get to the end, during, let's just say, the beginning of active labor to the point where, the mom starts pushing, I know the labor and delivery nurse plays such a major role. I know I was in active labor for about 20 hours, and she was my main contact. Yes. And we were in the labor and delivery room for quite a while, and my OB was not called in till reaching that 0.0, and so she was calling on the phone and saying, okay, we're at 8 centimeters dilated, and here's all the stats. And giving the updates, and
she is their main liaison to the rest of the team. So she again is a very good source of support, but she is also a part of the medical team, so she ensures your safety. She is typically the one who also performs the checks, the cervical exams, and will adjust the medications accordingly. She also makes sure that the doctors get there on time and has the right personnel around for your babies.
That's great that she is really the ringmaster, making everything happen. But it is important to note that in her role, she's managing all these different aspects from the let's say the medical provider side. Now, as a mom, I think one thing I learned is that I really could have benefited from a doula, because the doula's role is really to be the support specifically for the mom in managing pain and getting into positions that help further the opening of the cervix and descent and all of that. And I know I was laboring. I had an unmedicated labor during that time, and I was unsuccessful with the having a vaginal delivery. But I look back and I think, oh my gosh, I think that was probably the one thing that I could have benefited from, is having someone in the room who had knowledge of kind of helping me get into position, but maybe a better position for descent. So I think that's really important to understand some of the different roles that people play and not expect folks to.
Yeah, so this came up recently. I also I was an active laborer for probably about the same time you were, and my cervix ended up swelling. I got stuck at 6 centimeters, and I just never progressed. But in looking back at the labor process, I don't think. Like I said, I don't think I would have been able to move much at all. And it was definitely, the swelling was a concern and that. But, we talked about, I had my husband there, I had my mom there, I had my aunties there, all these very supportive people. I had an amazing labor and delivery nurse. So I felt very emotionally supported. But I think that what a lot of people forget is that your mom and your husband and your auntie, they're not trained in positioning, techniques, etc. And while my husband's very supportive, he knows absolutely nothing about childbirth. And and not for lack. He went to every class with me. He read the books I asked him to read. He's very supportive and engaged in the process. But it was something that it didn't occur to me to have that extra person there who could have helped with it in a twin delivery.
Let's talk logistics for a moment. So, when we're in the hospital room and we're having the delivery, what's actually happening? Let's say we give birth to baby A successfully, and then there's this time period where we're waiting. It's like, well, wait a minute. We have one baby, and then what do we do with that baby? And then the mom needs to push the other baby, and I think you said we've got ultrasound. So how does that all work?
So after delivery of baby A, usually baby A, as long as baby A is stable, dad can actually hold baby A, and dad can actually do skin to skin with baby A if he wanted to. If mom is still pushing and dad wants to be supportive for mom, then the nurses can actually help take care of baby A while mom is pushing. Again, depending on the position of the baby and if baby B depending on the position of baby B, depending on if baby B is flipped or not, hopefully the time interval is less than 30 minutes to an hour to deliver baby B. And hopefully as long as baby B is stable and the heart rate is reassuring and mom's vitals are reassuring, then we can allow labor to progress. Occasionally, if the contractions have spaced out, we might give mom a little bit of extra medication to help increase the frequency of contractions to expedite the delivery of baby B, so that the cervix doesn't close, or so that the placenta doesn't separate, just to make sure that we deliver baby B vaginally successfully.
Oh, that's great. So, and that's, I guess, another thing that we'd want to talk to our provider about, sort of thinking ahead and planning, what are my options?
Right.
I think when you tell people that you're planning on a vaginal birth or that you want an unmedicated birth with twins, everyone just kind of rolls their eyes. And but I think that the more you can do to prepare, the better, but with still the understanding that even the best laid plans with 2 babies can kind of go awry.
So what do you say to the moms who are saying, I really, really, really want a vaginal delivery?
I think it's great to want, and I think that but I also think it's important to realize that for the safety of both mom and baby, things, and for things that happen unexpectedly in labor, that it's always a possibility that we may have to go the other route. So I do tell them that ahead of time.
I think it's kind of hard because you don't want to discourage moms at all from attempting a vaginal delivery.
Absolutely.
Or be like a downer.
Yeah.
Like, this is a great plan that you have, but good luck. I think it's kind of it is kind of a fine line, because I wouldn't say they didn't warn me. It's not that I wasn't aware. It was more like I just figured if I did A, B, C, and D, then everything would go fine.
All right. Well, thanks so much to everyone for joining us today. And for more information about preparing for a vaginal delivery or for more information about any of our speakers and panelists, you can visit our episode page on our website. This conversation continues for members of our Twin Talks Club. And after the show, we'll talk with Dr. Tith about how moms can find providers who are very supportive of vaginal deliveries. So for more information about the Twin Talks Club, visit our website, twintalks.com.
We have a comment from one of our listeners that we want to share with you guys before we wrap up today's show, and it comes from Amanda, one of our Facebook friends. And Amanda says, I am so glad to have just found this podcast. I found out I was pregnant in February, and I discovered Preggy Pals. And for those of you who don't know, Preggy Pals is our sister show, all about pregnancy. She says, and I've been listening to Preggy Pals constantly. I just found out tonight about Twin Talks, and I couldn't be more thrilled because we're having twins. Can't wait to get through all those episodes of great twin info. Thank you so much for creating a podcast just for twin moms. Well, Amanda, thank you so much for listening to our show. And please spread the word for those of you guys that are listening to the show. If the show has helped you, please tell other twin parents about it. We're starting to grow, and that's fantastic. But word of mouth is always the best way for people to find out about resources like ours. So spread the word. We would really appreciate it. And thanks so much, Amanda, for the comment.
That wraps up our show for today. We appreciate you listening to Twin Talks. Don't forget to check out our sister show, Preggy Pals, for expecting parents, and our show, The Boob Group, for moms who breastfeed their babies, and Parent Savers. It's your parenting resource on the go. So next week, we're going to be talking about preparing for cesarean birth. This is Twin Talks, Parenting Times 2.
This has been a New Mommy Media production. The information and material contained in this episode are presented for educational purposes only. Statements and opinions expressed in this episode are not necessarily those of New Mommy Media and should not be considered facts. While such information and materials are believed to be accurate, it is not intended to replace or substitute for professional medical advice or care, and should not be used for diagnosing or treating healthcare problem or disease or prescribing any medication. If you have questions or concerns regarding your physical or mental health or the health of your baby, please seek assistance from a qualified healthcare provider.
New Mommy Media is expanding our lineup of shows for new and expecting parents. If you have an idea for a new series, or if you're a business or organization interested in joining our network of shows through a co-branded podcast, visit newmommymedia.com. Hey mamas, don't forget to check out Mighty Moms. It's our online community built for new moms just like you. Not only can you connect with other moms, but you can also join us backstage for special mom-only online events. And you'll also be notified when we're recording so you can join us as a special guest. Visit our website, newmommymedia.com, and click on the Mighty Moms banner. It's free. That's newmommymedia.com. See you there.